Okay, we're going to demonstrate the use of the Burtonbands Posterior matrix system, which is essentially a Versa wedge, which if you've not seen that yet, it's a wedge that splits down the middle. That's the Versa wedge in the orange, Burtonbands Posterior in the purple. The Burtonbands Posterior, like I said, is essentially a Versa wedge. It's a split wing wedge with a pre-contoured matrix band attached. This pre-contoured matrix band has a built-in marginal ridge and also built-in axial contours that allow it to really give your composite restorations an amazing shape and do it in a way that eliminates gingival flash or overhang and cleanup, and also really lessens the amount of time needed in the gingival embrasure anatomy and shaping, and the occlusal embrasure formation and things like that on your marginal ridge, which are really important to flossing and avoiding food trapping in patients. So the Burtonbands Posterior is designed for non-adjacent lesions. This is an important factor. If you've got something like this, place 2 sectionals, Versa wedge and ring, and go to work, and you're going to be super efficient. But these types of cases, I recommend using a Versa wedge and using a sectional matrix. But for other cases like this, where this is a bit of a medium plus size lesion here, perhaps an old amalgam removal, you don't always need a ring in these cases, or you don't have to always go through the setup of doing it. And so this is where the Burtonbands Posterior comes in. It's a unique system. It's used for smaller lesions. It can be used with without a ring for something like this, on the mesial here of that molar. But something that's mid-sized like this, a lot of times I'll just pop a ring on it just to make sure. So what you do is you kind of determine which side you're going to insert from, and these can be inserted from either the buccal or the lingual palatal, depending on the case. So in this case, I'm going to insert from the buccal. So what you're going to do is just place the 2 tips of the Burtonbands Posterior in the embrasure and just let it glide into position. Okay, so I'm putting like medium pressure on that wedge head handle to get it in position. But as it does come into position, you can see something happening here. You can see the wing split of this wedge, and that's allowing the matrix band to kind of follow the contour of that tooth, and also using the neighbor tooth as a kind of a stabilizer for the wedge and to hold things in a position. So at this point, what I do a lot of times is I kind of test how firm is my wedge in there, like how stable is this case. If you can wiggle it at all, or you're in doubt of how much of the matrix band is contacting the adjacent tooth, simply put a ring over the top of it, which I'll demonstrate now. And this is quite a unique feature. It's kind of like a 1-part setup, right? You don't have your matrix band and wedge. You don't have to worry about the matrix band running away when you put the ring on. But all you're going to do is just place the one side of the ring, and this is the Triodent ring, over the handle, and then you're going to let the other side of the ring float in between the split wings of that Burtonbands Posterior matrix. What that's going to do is really draw this wedge wing and matrix band that it's attached to right tight here with this tooth, and really create a nice little house here for your composite restoration to go into. And the contours on these matrix bands were specifically designed to just kind of recreate this anatomy, and at the same time kind of seal off the axial walls. And so when I'm using sectional matrix bands, I'm doing a lot of trimming over here in these areas where things kind of squeak through at this occlusal portion of the prep walls. But this system really seals these walls up, and especially the gingival margin. And if I could zoom down there, I would, but these gingival margins are tight, and that's because this ring is really pulling that matrix band really taut against it. But also defines your marginal ridge, so you can kind of look from the side here, and it's got this little hood feature that just really defines it. So when you restore, you know, you can place your material just, you know, up to the bottom of this little tab here, and this marginal ridge is formed for you. So when you remove this, it's just a little bit of occlusal adjustment, and your marginal ridge is really, you know, 95% done. And that's where I found myself spending a lot of time. So at this point, you just polish and, restore, and then remove the ring. And once you remove the ring, these matrix bands can really be in there pretty well with the force of the wedge and the ring, and also any bonding agents you use. So what I do is, and you should do this as well, is just take like an Explorer. I'm just using a pair of cotton pliers here just to demonstrate, but take an Explorer and really run this, just pop that matrix free, and then just grab your wedge handle and kind of wiggle in an up and down motion to remove it. And then you're all set to polish and finish. And there's a modification step that I recommend as early users or first time users kind of get acclimated to using this system. It can be a little bit different inserting a plastic wedge that has split wings on it, because the force required to do it is a bit of a learned feel touch thing. So as you're getting used to this, what I recommend is you take a pair of scissors and you just cut off this opposite wing. Okay, so you don't need this opposite wing all the time. And while you're just kind of getting comfortable inserting this, especially if you've never inserted a lateral matrix before, it's a little bit different, but this will make it a lot easier and a much more streamlined. So just pop this extra tab off so it looks something like this. Okay, and this can also be a modification for tight embrasure spaces. So if you have some premolars that are really tight, like, you know, they don't have much of a gingival embrasure at all, or I see this a lot in the distal of first molars and the mesial second molars. I'll just trim off one of these wings, the wing that's not attached to the matrix band, and it makes it like the world's skinniest wedge attached to a matrix that you can just glide this puppy right into place. So for early users, first 5 to 10, I would recommend doing this just to kind of get the feel for, you know, how these work. And you will quickly get the feel. It's not super hard. So the modified version with the one wing removed works the exact same as the unmodified version, and it's still ring compatible. You're just grabbing onto one less wing. So again, just place it over the handle of the wedge, and then just engage the one portion of the split wing, and you can restore. You're ready to go.